There's a lot of reasons that people have to do IVF or decide to do IVF, not just those two, but yes, there's the couple that cannot get pregnant on their own. For example, they have unexplained infertility. Then there's the women that do not ovulate, like some PCOS women. There's the women that have endometriosis, where they have a lot of scarring inside. And some need surgery to get rid of the inflammation. Some have their tube that are blocked, and which is the reason why IVF was created in the first place. And if the fallopian tube are blocked, the sperm cannot meet the eggs and you cannot get pregnant. Then there's the women that have diminished ovarian reserve. That means the egg count is low, so they have to work against the clock. And IVF is usually the fastest way before you run out of eggs or to give you the higher chance of getting pregnant every month. And then there's the couple that have male infertility issue. They either have no sperm or they have varicocele. They need surgery to get the sperm out, or they have very bad sperm count. And so IVF is the only option for them. Then you have the couple like us that have recurrent miscarriages. And so IVF is usually the fastest and the best option instead of just keep going through miscarriages and heartbreak. There's so many reasons for miscarriages, but in my case, the miscarriages was probably caused by a chromosome abnormality, which is the reason for 50% of miscarriages. Once the embryo are made in the lab, then they are sent for testing, and then you can find out if they have Down syndrome, trisomy 18, 21, whatever other extra chromosome, because we have 44 pairs of chromosomes. So risk of chromosome abnormality is actually very high, and it gets higher as you get older. Also find out the sex of the baby at the same time. And that way you only transfer the genetically normal and healthy embryos, so you reduce your risk of miscarriage. And then there's a third type of couple that actually know that they have a genetic condition and they do not want to pass it down to their kids. For example, spina bifida, cystic fibrosis, sickle cell disease, Fragile X, all of those and hundreds of more genes are actually hereditary. So if mom and dad carry the same gene, you have a 25% chance of giving it to your kids. If only one of the parents carry that gene, your child does not have a risk. But sometimes the couple or one person know they actually carry that gene, or they already have a child with that disease. So they're gonna do the same one after the embryo are made in the lab. They're gonna send them for testing, and that way they can transfer a healthy embryo to have a healthy baby and not have a baby with that condition. As you can see, there's a lot of reasons that people decide to do IVF or that they have to do IVF. IVF is not always the solution. IVF is most of the time the last resort because we already tried every single treatment, nothing works, so then we go straight to IVF because it's the last and best resort. We also all know that there's no guarantee with IVF. It's not because you're doing IVF that you're gonna have a baby at the end. There's also the little nuance of IVF where people have to do IVF, but they also get egg donor or sperm donor, either because they run out of eggs or their husband doesn't have sperm. Then there's also the woman that freeze the eggs. And so if you freeze the eggs back then now you need to do IVF with those eggs. Then there's the couple that also do IVF and then use a surrogate. So they will transfer the embryo into another woman to get pregnant because they cannot physically carry that baby. And of course, I forgot the same-sex couple. So they need to get egg donor or sperm donor. There's the single mom by choice. So they need a sperm donor and they need IVF to get pregnant. So as you can see, IVF is not one size fits all. It's not always a solution. There's so many different reasons that people do IVF, and I'm pretty sure I missed a lot of them. But I hope this helps answer your question.